They sometimes don't recognize it themselves.
That's right, but don't know where to go
to
get the help. And one of the key things that we have to do as CEOs for the centers is that we have to hire the most appropriate staff that we think can help address it. Right. So we have clinical social workers on site too, who really, there's a chance, a bigger chance that a person will sit down and talk to that person and share with them the problems that they're having that they may not share with their doctor until they feel comfortable. And then once they do, then that social worker can partner with the doctor and try to help meet those needs. And our social workers will go out to the homes too. And that's something that is real welcome from our patients as well, just because if they feel comfortable enough to talk to you in your setting, and then they feel welcome enough or comfortable enough to have them come to your home, then we know we're reaching them in a better way.
Well, that's great. Tell me a little bit about the Grand Prairie Center.
Well, the Grand Prairie Center, we actually applied for a grant and we didn't get it, and Leonor and the board of directors of Los Barrios Unidos Community Clinic knew that Grand Prairie was very underserved. It was a medically underserved area, and in a leap of faith they opened the center anyway on October 20th of this year. Much less staffed than they would have done otherwise had the funding been available, but they did open it. And the goal, if it was fully staffed, was to see approximately 5,000 patients in its first full years of operation, with almost 13,000 visits. And that's of a largely uninsured population who otherwise would not have access to health care services. Now that we have received some funding to be able to fully staff, we'll be able to meet those goals of 5,000 patients in 1 year. We are having a grand opening, in fact, celebrating it because it is now a grand opening on April 17th. And we already have approximately 700 patients and families opening now. It's a very diverse population. And we couldn't be happier. The community is just embracing us.
Where is it located?
It's located on Small Hill Road and Stadium Drive, which is actually across from the Grand Prairie North High School. So it's in northern Grand Prairie, right off of Interstate 30 in Dallas, Texas, and Beltline Drive and Interstate 30 in Dallas, Texas.
I know exactly where that is.
Yeah.
I used to have Grand Prairie in my district.
You did? Really? Okay. So you know Grand Prairie.
You know Grand Prairie.
As a matter of fact, I had Grand Prairie also when I was in the state senate.
Oh, okay.
I've had almost every part of Dallas County except Highland Park and University Park.
No kidding.
And I stopped right at the city limits of Highland Park now. But I have a great constituency. It's very diverse, from the very wealthy to the very poor. And I don't know that there's any part of it that's hostile. And
this is one of your constituents in the middle. Certainly neither wealthy, not very poor.
Well, we are definitely finding that, given the way the economy is right now, we are seeing a lot more people who had a lot of money, and now they don't.
That's right.
And so they're having to address a lot of issues. And so I know that they're definitely supporters of yours, but they're also folks that we can definitely welcome, because if they need the care, regardless of how much money they have or don't have, we're going to see them.
And you know, Dallas only has 2 community clinics, community health centers. Other cities like Houston have many, many more. So we're hoping, all of us here, that we'll be able to expand and have more clinics serving the Dallas area, and just expand in Texas in general.
That's right.
Well, it really takes the load off of our public hospital facilities. And it takes a lot of stress off of people, because often they wait very long hours when they go. And it's not intentional. It's not done for punishment or anything. It's just so many people to be seen. But we have the medical school there that helps a great deal as well.
Absolutely. Well, we really feel like as community health centers, we can take a lot of that load off the emergency room. We don't fancy ourselves emergency rooms. We're not trauma centers. We never will be. We don't want to be. But there are a lot of people.
60% of the people that go to emergency rooms
don't need
are not emergency rooms.
That's right. And so we are there for them. And we have done a lot of things like expand our hours. We've got 2 evening clinics now. We've got weekend clinic. All of those things that entice people to emergency rooms, because their doctor is not available 24/7. But the more we expand our hours and make ourselves available, the better it is for the family and ultimately the community.
And you really have an increase because of the recession.
Yes. That's absolutely the case.
Right.
We started seeing a new picture of the new uninsured, and we've had some of the same patients for really decades now. We've been around for 37 years, but we have new people. When there was a plant closing not too far from us, and guess what? Just within a matter of weeks, really, as the insurance coverage ran out, we're seeing them in our clinic.
We had a story done on WFAA Channel 8 recently and received a call not shortly thereafter because they wanted to spread the good word of community health centers and that we were there, from a Richardson School nurse who said that the city of Richardson was struggling in terms of access to care for the uninsured and the underinsured. And we will be meeting with all of the Richardson School nurses very shortly to talk about the clinic, so that the Richardson School nurses, which is far north of us, as you know, will be able to refer their children to us, their young uninsured and underinsured patients.
Well, that's great, because I can tell you, we have such a high-tech environment, and those layoffs are coming. For each layoff, 2 other jobs usually go with them. The persons who help in the home, the person who help in the yard.
That's right.
If they don't have a job, they can't afford to keep the help. So then we have 3 for every job that's lost. And I think we lost like 46,000 this year in Texas. So we do have a job to do, and your job will probably get a little harder before it lights up.
Well, we're people. It takes special people to work in community health centers. You have to have a desire to help anybody, regardless of where they came from. You have to have a desire to understand how important health care is. I always value, if we can value our car and keep it clean and keep it oiled and put gas in it, we need to value our lives, because we can't drive the car if we don't have our lives to take care of. It's our goal to be able to go out and educate people, let them know that they can come, they have a place to come. We can be the safety net provider, their medical home. They can always come and get any kind of care that they need, and even if they don't need the care, just come for prevention, so that they can make sure that they are not sick, or they don't have any type of illnesses and things. And
that is the most important of health care.
Getting the shots for your children on time, getting your TBs every year, just different things that they can do to prevent themselves from getting sick. So that's our goal too, is to be able to really show that we care and have the folks learn to care about themselves and their health and their families.
And you teach.
Exactly.
Well, our time is about out, but let me thank you for what you do. You're much appreciated.
Thank you.
And I can tell you that there are many, many people in the area that's very appreciative of you being there, for your attitudes, for your receiving them warmly, and for teaching. So we thank you.
Thank you too.
And we thank you for your support as well.
Well, thank you. And thank you for watching. We will see you next week.
This has been another edition of Report from Washington, featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.